what delegation means? Aristotle. Great answer. Aristotle just mentioned that there are 5 rights of delegation. Angelina, can you tell me what those rights of delegation are? So Angelina just reported person, task, circumstances, directions, as well as supervision. Great job. So whenever we delegate, we must ensure that the 5 steps of delegations are delegated and that we utilize some strategies to identify when any of these have been missing. So with this upcoming activity, we're going to be reading a scenario and you are going to be telling me if there's any omitted information from the scenario and whether or not the task was appropriately delegated or there were needs for appropriate actions that were omitted. Okay, so let's go on to the scenario. Okay, what delegation steps are missing from this scenario? I have a volunteer from the audience to read. It says the RN delegates to a UAP to ambulate the client, and the client is 2 days post-op. This client is also asked to be ambulated for about 20 yards every 2 hours. So, with a show of hands, who can tell me which, if any, of the steps of delegation have been omitted? Aristotle. Supervision, he says. Excellent. Angelina. Wonderful. And what she should report to the RN. So some of the things we need to say are the client is needing a pain medication probably and able to do it on their own without any kind of adjuncts needed to ambulate the client? Or is the client actually needing 2-person to ambulate them down the hallway? Okay, so who can tell me, based on what we have read, what was missing from this delegation scenario? Isabel. Great. Isabel states that directions and supervisions were omitted from this scenario. Excellent job. So we have another practice exercise, and we are going to now pull out our folders and utilize our cards to raise our numbers to answer our questions appropriately. For this question, we'll be utilizing the stop technique. And the stop technique is going to have us answer our scenario with our select all that apply. We are still on delegation. We are now going to read a question that deals with delegating a task or 2 or 3, depending on what we find, to a UAP. It says a nurse caring for a terminally ill client with cancer should delegate the following activities to a UAP, and we should select all that apply. Number 1, encourage the client to state how he feels about his terminal illness. Number 2, ambulate the client to the bedside chair twice a day. Number 3, demonstrate to the client the proper use of a bronchodilator inhaler. Number 4, complete vital signs that includes oxygen levels or oxygen saturations every 4 hours. And number 5, obtain a urine specimen from the client's indwelling bladder catheter. Let's pause for a few moments, and I need you to raise the answers that you have decided on that is adequately delegated to a UAP. Awesome job. I see number 2 And I see number 4. So the whole entire class did awesome on the select all that apply by using the stop approach. Let's review the stop approach. The stop approach states that we're going to read the story, which we did when we read the body of the question, right? We looked for keywords in the delegation of the UAP and the task. We know the story. We're going to use T to think about what the question is actually asking us. We need to critically think and say, this UAP is able to perform the task based on their scope of practice. Then we're going to read the options, which is the O. The O will tell us which options are appropriate to be selected in the UAP scope of practice. And lastly, P means pick. So number 1, is that a UAP task? No. Feelings about the terminal illness is not a UAP task. That's a higher level, more of an LPN, an RN function. Number 2 is assisting the client to the bedside. UAPs are absolutely able to do that. Number 3, demonstrating a proper use of a bronchodilator? No, I don't think so. That is a medication, and UAPs are not able to medicate patients. Number 4 is vital signs, absolutely under their scope of practice. And lastly, number 5 is a urine specimen from an indwelling catheter. So that, again, is a higher level skill that is not able to be performed by a UAP. So moving right on, we have another scenario that has to do with an LPN and a select all that apply using our stop method again. So once again, I need you to use your numbers that have been provided to you and just read the questions. Let's pause for 30 minutes. We have a group volunteer that is going to be reading that question. She states, a nurse cares for a group of clients on a med-surg unit. Which client should she delegate to an LPN? Okay, so this is a stop approach again because it's select all that apply, and we are going to read all the options. Okay, so number 1 reads newly diagnosed diabetic type 2. Number 2, facial lacerations with a subdural hematoma. Number 3, bronchitis receiving bronchodilator treatment. Number 4, exacerbation of myasthenia gravis admitted 3 hours ago. And lastly, number 5, advanced regular diet 2 days post-op cholecystectomy. So let's give you some time to use your stop technique. You may raise your numbers when you are ready. I see number 3, great job, Angelina. And number 5, absolutely. Now let's take it under investigation and figure out why we made the choices that we made. Number 1, newly diagnosed. Key term there. That is a RN function. For a newly diagnosed client with diabetes, they're going to require education. Number 2, facial laceration with a subdural hematoma. Is that a stable client? Nope. That is definitely an unstable client. Number 3, Aristotle. He is saying the bronchodilator is stable, absolutely, because he's a bronchitis patient that is used to receiving his bronchodilator therapy. Number 4, exacerbation. Monique. Exacerbation is definitely a trigger word to say that this is a crisis. And lastly, number 5, advanced diet 2 days post-op. So that sounds pretty stable to me. Awesome job, class. We'll move on to the next activity. So far, so good. You're doing wonderful. Now let's take a look at scope of practice. We have the UAPs, and who can go to their NCLEX live review book. We're going to pull out our activity from page 13, and we're going to do this activity that's related to the delegation on page 13 and 14 of your text. We are going to be giving you about 2 minutes to figure that out. and we are going to get your feedback. So, page 13 and 14, guys. Let's find that in your book. All right, so a UAP is able to do what? ADLs, vital signs, weight, eyes and nose, and safety. The LPN, stable client, data collection, reinforcement of teaching. Awesome job. Lastly, the RN is going to do unstable client, assess and teach and plan of care. So anything in the nursing process will not be able to be performed by a UAP or a LPN. Those ADPI functions, assessment, diagnosis, planning, implementation, and evaluation, are only done by the RN. Great job, guys. You are doing amazing on these learning activities. Next question. Now, the nurse is assigned 4 clients to an LPN, okay? Which finding made by the LPN requires immediate report to the RN? Number 1, an IV antibiotic with a rash in the left groin. Number 2, baseline pulse of 88 who has changed to an irregular apical pulse of 120 today. Number 3, a recent diagnosis of terminal cancer refusing to eat or participate in their hygiene care. And lastly, an 8-hour post-op laparoscopic surgery reporting abdominal distension and shoulder pain. I'll give you a moment to think about the answers. I need you to hold up your cards and pick the right answer. This is not a select all that apply, but again, we're going to critically think our way through which one is a appropriate answer. Aristotle, great job. Number 2. Number 2 states that a baseline of an apical pulse was 88 and it's now changed to 120. That is a new change that needs to be reported by the LPN to the RN immediately, because what's the RN going to do? Who can tell me? Angelina, absolutely. The RN will now assess the patient, and now the stability of the patient has changed from stable to unstable.